Welcome all to our first installment of our MSL focused podcast at Ashfield Engage. I am your host, Chris Tooley, Digital Marketing Executive for Ashfield Engage. And co-pilot with me today is Elizabeth Johnston, Marketing Manager, Medical Affairs at Ashfield Engage. For our first episode, we are super pleased to introduce two of our in-house MSL experts, Jeff Vaughan and Tiffanie Stewart. So Jeff, if we could start with you, just get you to introduce yourself.
Thanks, Chris. Good morning, everyone. Just excited for this first ever podcast for Ashfield Engage. And really for it to be focused on such a hot topic right now, really talking about the medical science liaison, being a key player in industry and seeing the uptick of demand for this particular service in pharmaceutical companies. And I think we're really fortunate today to have Ashfield Engage to surround ourselves with the experts and talent around the globe. One of the nice things about Ashfield is we work in different divisions. Specifically, Engage is focused on the medical affairs umbrella, but bringing together our experts in the field and sharing a little bit of the information and insight is the focus of this first podcast and subsequent ones. So today I'd like to welcome Dr. Tiffanie Stewart and just take a moment for her to share her background and introduce her role as an MSL, and we'll go from there. So Tiffanie?
Thanks, Jeff. I'm so excited to be part of this MSL focused podcast series because I am an MSL and a lover of podcasts, and I don't think there's enough MSL focused podcasts out there. So this is wonderful. I have a PhD from Florida International University, where I conducted HIV research for several years in HIV positive adults in Miami. And I simultaneously worked in a nanomedicine lab, which was more sort of experimental research to investigate drug delivery systems using magnetoelectric nanoparticles. So pretty diverse background there. I was recruited to the University of Notre Dame to expand their nanomedicine program. And during my time as a researcher, I always enjoyed presenting data at conferences, networking, receiving feedback from different stakeholders, and figuring out how the data sort of translated to real world practice. So when I found out about an MSL, what the MSL role was and what we did in the field, I thought it was a good fit for me, given that, you know, I really did enjoy that translational part of research. I started working as an MSL for Myriad Genetics in their neuroscience division in 2018. Loved the job. It was a bit of a learning curve for me coming from a university setting as a researcher. And then I moved to Ashfield Engage, where I work with a wonderful team in the field of infectious disease now. So I'm getting closer to my scientific roots.
Thanks both for your intros. That's really great. I think we'll probably start off this series today then with peeling back the onion, I suppose, on what exactly an MSL does and discussing how your role's evolving. So I guess for someone like me that's relatively new to pharma and relatively new to what an MSL is, it'd be great to kind of get that elevator pitch. So if we start in the mindset of an MSL that's just starting out, Jeff, in your experience, what's the traditional background of an MSL, or is there one?
That's a great question, Chris. I think if we're talking about the MSL and their requirements today, background-wise, it would be far different than what it would be considered 5 years ago. Taking things back a little bit, and as you were saying, peeling the onion back and the layers, I think about when I first started as a medical scientist. Typically, pharma companies looked at candidates that had terminal degrees. So essentially, if you weren't a PhD or a PharmD or an MD, you were pretty much outside, the box looking in and hoping that someone would give you an opportunity based on maybe a clinical skill set and not having that terminal degree. But I think the role has evolved over the last several years. into hiring managers taking a step back and looking at clinical qualifications. And I think access has also been an issue with COVID. And, commercial interactions with KOLs have been more limited than normal because of COVID. So as a sense, you really have to rely on your colleagues, your medical colleagues, to try to get those conversations and get that information to the key opinion leader. And I would tell you that a lot of the rethinking is taking a look at, well, what clinical experience and roles have they served within an institution? And perhaps that network of key opinion leaders that clinician knows would help our company just from an access standpoint. So in the past, I've brought teams on that typically have been terminal degree holders. But again, 3 years ago, I think that mindset has changed a bit. And I've had nurse practitioners, PAs, nurse educators, a respiratory therapist. And I know we'll talk about this a little later and sort of what I look for when I try to recruit a team or an individual to a team. But I think when you just putting your thumb on it and saying the MSL background is something that's just a one-word adjective, you can't do that anymore because it's really multifaceted due to just how our changing environment has dictated that. So
yeah, I agree. When I started researching the MSL role, there were very strict sort of instructions that, MSLs have a terminal degree, PhD, PharmD, MD. But I'm seeing now that that's not always the case. MSLs typically hold an advanced degree because the purpose is to engage in compelling scientific dialogue. And so it's believed that when you have an advanced degree, you're able to do that. You're able to drive the science, get feedback from leaders, be, trusted advisors in the scientific community. But what I'm starting to see, as Jeff mentioned, is there's a shift where you don't necessarily have to have a terminal degree to be a successful MSL. I worked with pharmacy technicians who were even, top of the class MSLs because they came up with really well thought out strategies. They were able to take, graphs and figures from clinical trials and present them in ways that really resonated with KOLs, HCPs, thought leaders. So, saying things like, what these data are telling me is that with, this set of comorbidities and with these diagnoses, there's evidence to support A, B, and C. And they had that patient experience with patients. So it helped them be able to translate that science. So I agree. I think a terminal degree, gives you that credibility. It's you're practiced in taking, evidence and data and publications and translating that into real world, but that's not always the case. You can always do that with, real world clinical experience. Like you said, Jeff, a nurse educator or a respiratory therapist is a great example. Mid-level providers, I think, make really good MSLs too. So I see that shift as well, just sort of on the ground level. And I think that I'll add that COVID-19 really changed a lot. MSLs have to be more collaborative and innovative and be able to work cross-functionally while being compliant. So personality, those soft skills like having emotional intelligence, compassion, empathy, understanding the person sitting across from you. Maybe they had a bad day and trying to navigate the conversation in that way. And doing that virtually is even harder. So you kind of have to like fine tune your soft skills in that way. I think that's made a lot of, that's sort of broken the mold of the traditional MSL. We had to be more innovative. And so that's why we're now focusing more on finding better ways for insight gathering and analysis, finding better ways to fine tune our soft skills to maintain relationship with KOLs. I like to think that as an MSL, if I'm doing a good job, if someone from, leadership wants to meet with one of my KOLs, within the week, I could be able to do that. I could land that meeting because I have developed a deeper relationship with my thought leader, with the person sitting across from me. And I think that's a mark of success in the MSL role. Does that resonate with you, Jeff?
It does. And I was thinking about the same concept when we talk about the virtual engagement and how it's just different now. The meetings are different and how much more of a challenge it is for a lot of the MSLs, particularly on the first engagement, the first meeting, because we're so used to the same like face-to-face handshakes. Those are kind of going away, at least right now. I hope they're not gone away forever, because I think by nature, we need that, just a humanistic contact, and having the eye-to-eye contact is artificially, it's tougher. And I think as that being the case, the MSL's sort of emotional intelligence, their personality really has to jump up out of the screen, because you're sort of handicapped by, having that first meeting and on a camera in Zoom, and not to mention all the technical issues that can go wrong and will go wrong. You also have to really dazzle and impress, if you will, that first, that KOL on that first meeting, enough so that they want to talk to you subsequently. And that's probably the toughest part, is follow through, is because we have created this artificial environment that we're working in. And what's even, I think, more challenging too, is just saying, hey, can we do this again? I know this was really awkward for both of us. And, we're struggling through the technology piece. I hope that what I shared with you really had some added value. And can we do this again virtually? It's a lot to ask anyone that you're meeting for the first time.
Yeah,
right?
And when you're first starting out as an MSL, if you come from a clinic, or what my case, university setting, that sometimes is intimidating to even ask that question. Like, can we meet again? It's this sort of fear of rejection, I think. And even in-person meetings, we're wearing a mask. Like, your smile is sort of your best selling point, and you've lost that whole part of your face to be able to make that connection with another human. So, I mean, you're right, it's challenging. And you're right, asking, are you comfortable with meeting again? I always say, when I started adopting this idea of, I'm going to go into a meeting with a KOL hoping that they want to meet me again, rather than going in, when I first started, I wanted to go in and data dump. I wanted to go in and tell them everything that I knew, because I was so smart, which typically worked in university settings. When you went to conferences, people wanted to hear what I had to say because I had research and I was presenting, and they came specifically to see me talk or my poster or whatever. But it's not the same in this industry. That was like one of the biggest roadblocks I had, is understanding that how I say it, how I interact is more important than the information itself sometimes.
I think that's a great line. I almost want to hit a pause there and let that sink in, because I feel like that is the underlying key point that is coming across here. And I was going to actually ask a question to get both of your perspectives on that point, which maybe you're even going there, which is like, how do you prepare yourself for that skill set? Like, is that just nature versus nurture? You're just inherently charismatic, and so because you also have this really great gigantic education, Tiffanie, and you're doing these talks and you have tons and tons of knowledge, but how did you prepare for being able to go into that more personal conversation? Like, I just imagine that when you're in front of a lot of people, you kind of feel slightly anonymous. It's not as, maybe it's more intimidating to sit across one-to-one with somebody. So how did you prepare for that change?
I didn't know how to prepare for it. I went in, and I think it's true for a lot of MSLs. I think we go in thinking they'll want, KOLs will want to hear what I have to say because I have a meeting with them. And it takes a lot of trial and error. Jeff and I were just talking about this, the trial and error that it takes to develop the soft skills to have a meaningful connection with the KOL. I mean, on average, I would say it takes 1.5 to 2 years to figure out that skill set. COVID helped me put that into fast forward because I started reaching out to my KOLs just to check in on them and see how they were doing because everyone was overwhelmed. And I found that, and I wrote this saying down, people don't necessarily remember what you say, but they remember how you make them feel. Mm-hmm. And as soon as I sort of like adopted that into my interactions, I mean, it was like night and day. I would get return phone calls, text messages from KOLs, thought leaders. People would return my emails in a timely manner. That was nice. I mean, so, going back to your point, it's hard at first to figure out that you going in and data dumping is not necessarily, I mean, that's not true for everyone. Some KOLs and thought leaders just want to look at the clinical data and pick through it, with you. It's hard to figure out who that person will be beforehand. You can do, all the pre-call preparation that you want, Googling, maybe talking to, in a compliant way, talking to the commercial team if they have any insight on the personality of the person you're meeting with, going into your CRM and figuring out how many times this person has interacted with the company before. Do they, watching any webinars that they might have had, going to their LinkedIn page, figuring out what their background is. You do all of that pre-call planning to sort of figure out their personalities beforehand. But once you get in the moment, that's where your soft skills really, kick in, and you try to roll with the punches. I mean, the other, and Jeff and I talk about this all the time, the other really important preparation tool is to figure out what, Jeff, what do you call them? Listening priorities?
Yeah, I stole that from a company that I thought that's really interesting is listening priorities. I think you touched on it though, Tiffanie, and when you talk about preparation, all of us learn at different, I guess, speeds, if you will. This job, I used to think long ago, Elizabeth, that it was sort of innate, the nature of being a good MSL in terms of personality. But I think it's a combination of both. I think the people that inherently are just, they're the quarterback of the team that walks on, as a redshirt freshman and throws for 50 touchdowns in a season, and you think, wow, how did they do that? They're naturally gifted, in that ability to be able to throw that ball. Well, I think there are MSLs out there that have that innate ability to just hit all the points on cue every single time and they can do it in their sleep, but they are far and few between. I would say of probably 100 MSLs that I've been affiliated with to one extent or another, you're probably talking about 4 or 5 out of 100. Everything else has to be, you've got the base knowledge, the academic knowledge, maybe the clinical experience, the soft skills piece of it, and the emotional intelligence, awareness, all that really should be mentored and trained through with your team. And unfortunately, like Tiffanie was saying, you sort of learn by the school of hard knocks when it comes to making those type of mistakes. And one of the goals that Ashfield that I'm trying to do is bring on and mentor our team. So we have that retainability from within the company. And I would say that generally speaking, whether it's a contract company or it's an in-house pharma company, we need to do a better job as an industry of not just talent acquisition, but mentoring our talent and keeping our talent in-house. I think I can't really stress that enough because I see so much of it going on. And I would venture to say in business as a whole, good leaders keep their people and find a way of really digging into their psyche and saying, what is it you really want? What's your long game? What's your intermediate game? And enabling that person to reach those goals. And I think from a perspective of being an MSL director, I'd like to challenge other leaders in field medical to do the same.
Yes. Thank you for saying that. I mean, I think it's music to our ears as, individual contributors are that when a manager says, what do you want out of this? What are your long-term professional goals? It's really a wonderful thing to feel like your needs are heard and you're not just sort of a cog in the wheel of the company. So yeah, that's I'm glad you said that, Jeff. Mentorship is so important, and understanding like a mentor-mentee relationship where it's not just the mentor giving advice all the time. It's more of like a two-way relationship. Mentors can act as, mentors typically get involved in, every aspect of that person's life, understanding what their struggles are in their personal life and professional life, and coming up with creative and sharing their own personal struggles too. So something that I learned about mentoring when I was mentored and I acted as sort of like a mentor trainee was it's really important to be more like a coach and as well as a mentor and have that two-way relationship. But I think I sort of got off track there, but I'm glad that you said that you pointed out that how important mentorship is in this role, because there are funny questions that I feel like we have to ask, like getting down to the nitty-gritty. I'm trying to think of an example of a question that I asked that was just really minor. Okay, so I had an interaction with a KOL today, and it didn't go as well as I thought it would. Maybe the KOL was having a bad day. Maybe I was having an off day. And because this job is you can feel very alone because we work remotely. We're not in office. We're not always plugged into our teammates. Having someone to turn to and call after that meeting and say, I think it didn't go well. I want to talk about it and I want to learn how I can do better. What would you have done? And then maybe you find out, oh, you did everything you could. And, or you could have tweaked something this way or that way. But having a person on the team to be able to lean on and feel like you trust them is so important in developing your MSL skills. It's a very vulnerable job, I think. You're putting yourself out there quite a bit. Yeah.
And it's interesting as I'm learning more about the role and focusing, my efforts and my attention within the medical affairs space, I'm kind of piecing together that the EQ side of this is so much more than just like, here's what we're arming you with in your toolbox to go out and be more effective at insights gathering. Like, it's the whole ecosystem around the person and almost as like a support network to, instead of just focusing on, how does you having a better approach to one specific engagement impact the insights that we're gathering, this hard goal. It's like, actually, there's a lot more to people in general. And this could really be across any profession as an ideal state to get to, right? What's a support group around your soft skill set? Where does that come from? What is the source of any of those issues that you're having with performance or whatever? But it's just interesting that, like, it seems like there's such a hard focus on your job is so valuable because you're gathering these incredible insights. It's like, well, let's back out from that. It's so much about this personal interaction. And as with any part of any job that's having interactions with people one-to-one or one-to-many, if you can't connect, like, what's the bigger issue? Like, that might be a symptom of something else. And I think that mentorship piece is really interesting, because it's not something I've encountered yet in doing tons of reading and research and getting familiar, but it sounds like it's really, pretty critical, or I don't know why it would be seen as almost like a new age approach to something, but I feel like that's maybe a little bit different.
Yeah, I think you're right. Yeah. Understanding, like you mentioned, emotional intelligence, that's sort of like a buzzword now in the field. We're all trying to improve our EQ. Most of us have the IQ down because of our backgrounds, but that EQ is something. And what's interesting is when I look around, look at my teammates, we tend to have pretty diverse backgrounds, pretty diverse life experiences, working as a bartender, for example, or in the past life, or going through some hardships, so that sometimes when people experience hardships in life, it does tend to make them more empathetic and compassionate to others, and that's part of EQ. And I'm not saying that that's like going through hardships is like a prerequisite for the MSL position, but being able to talk about things other than the task at hand,
Right.
making it all business is, like, I think, a pretty important soft skill.
I was actually thinking about this whole soft skills and EQ aspect of things. And it's interesting about what Tiffanie mentioned earlier about, some of our folks being just kind of having unusually in diverse backgrounds in terms of occupation and even education. And one of the focuses, I feel like, when bringing a team on from a recruitment standpoint, because I feel like a quarter of what I do for Ashfield is really talent acquisition. And I've always said a manager is only as worth as really his worth is bringing talent in and keeping talent. I think part of that is just to what you were saying earlier, just showing vulnerability is key to a lot of developing soft skills and emotional intelligence, because people, particularly on a first meeting, I know I used to be one of those KOLs that industry used to call upon years ago. And I've always tried to put myself back in that medical professional's role, and having sort of a mirror of who I am today, having a conversation with myself as a clinician. What would I want to hear? How would I want to be approached? I always felt, as busy as I was in clinic, I would always take the time out for, whether it was a sales rep for industry or a medical scientist, I would always take out the ones that had the personalities, I'm an AGT fan, and Simon Cowell says, I'll never forget you. Well, that same aspect goes with any communication process. Put on a personality, a show, if you will, a talent that makes me not want to forget about you and makes me want to come back to you and re-engage. So I think, you put things into a real world perspective and be relatable, being human. The soft skills piece of it kind of falls into play. There's specific teachings, but quite honestly, a lot of that is borrowed lines. I almost say borrowed one-liners, I'm a big James Bond fan, and I just saw literally a documentary of Daniel Craig, and one of the things that he admittedly said that made his series so successful as Bond was that he was able to plug in a lot of one-liners, and they were memorable throughout the movie series that he was the Bond in. And I think the same thing goes. People remember one-liners that have impact. And part of that folds into a soft skills piece, because I will listen to a really good medical scientist present data. And sometimes it's boring, right? We want to avoid our ears and our eyes to go tired on PowerPoint overload. What do we usually focus on? Key points, the key one-liners, the Bond moments, as I like to call it. We never forget those. So I think those pieces kind of play into those soft skills.
And
if that makes sense.
I think analogies are key. In my old role, I would even talk to clinicians and say, this is the analogy I use to interpret this data so that it sticks. If you come up with something better, text me because I could use it, like analogies, one-liners, that sort of thing. And let me just say, if you don't know Jeff already, Jeff is the king of one-liners and analogies. He's always entertaining our team with those thoughts.
Well, you don't forget them, right?
No.
Well, that's it. You've heard it here first. Then, if this podcast takes off, this is going to be the best piece of advice you'll get. Is if you want to be an MSL, just watch James Bond do what he does.
Yeah, it's not that hard, right?
Easy.
Don't jump off buildings without supervision.
I think too, one of the things that stood out as we're talking, because I'm thinking back, as in marketing communications world and the undergrad there, one of the things that a professor once said, it was actually just talking about rhyming. We were talking about poetry or something, but it was like, rhyming is candy to the brain. And maybe not necessarily the rhyming part, but the candy to the brain thing always stuck with me. So it was that in itself, very meta moment, was candy to the brain. But I think that's kind of what you're saying, is like having the emotional intelligence and calling it a communication process. I think that's another good way of phrasing that, is that what can, by molding things into a statement that becomes candy to the brain, that takes a couple different inputs, that takes that emotional intelligence, that takes the humanizing part to create different frame of reference for something. So there's like there's definitely a different type of intelligence to take something very complex and make it snackable and memorable. And that's something that you could repeat later easily. That is so difficult to do. And no matter what, like, industry you're in, if you have to communicate and you're part of that process, there's a lot of levers being pulled there mentally, and especially if you're on the fly, if you're in front of somebody that's brand new. So I can see why Tiffanie said it takes like a year to year and a half. You're just kind of logging those little snackable, bits of candy that you can kind of pull out whenever you need them in the right way, or adapt to the right audience, or whatever the data is.
So true. I love that. Candy for your brain. And I think coming up with that, like making the candy, requires both your left and right side. You need some abstract things, you need to pull it together. And, PhD backgrounds, we're sort of trained in thinking with the left side of our brain, very statistically, lots of regression models and just, just very process driven. And I am very process driven. So there are certain things that I'll do to try and activate that other side of my brain, like being creative, finding time to draw or be creative, or put myself in a place where I'm not just constantly thinking about numbers and and figures and that sort of thing. But yeah, that's practicing that is it's challenging. So yeah. What do you think, Jeff? You seem to be good at that. You use both sides of the brain pretty easily.
No,
what's your
really.
trick?
I just fake you out. I will say, just taking a look at, the skill set you were talking about, it was almost like a discovery moment where you're like, how do you take really difficult analytical data and make it conversational and interesting? And how hard must that be to do? It's extremely hard. I take a look at, and I talk to other people in business, not necessarily in the pharmaceutical industry, but that skill is really relevant across the board in business. And the amount of, I guess, comparatively, the amount of people that can do it well is very, very small. It's easy to find someone that is extremely technical, MIT educated bench work, PhD, like Tiffanie was saying. They can explain a molecule breakdown, pharmacodynamic breakdown of a molecule into the body to a level that even with my background in pharmacology would make it difficult to understand. But what's really unique is take that same person and have them take that molecule and put ears and a face on it into a cartoon and make it materialize and animate, where you could get someone that didn't even have a background in science to understand it. That is hard to do. And essentially, when we're visualizing complex data, I just gave you an example of taking a concept, and in your brain, you probably thought about, like, okay, how would that look in a cartoon? How would that look as a visual? Because we are visual by nature, and make it interesting. So that's sort of my feedback.
Yeah. Do you guys see what I mean? Elizabeth and Chris, do you see what I mean?
Molecule with a face on it. I'll remember that for the rest of the week.
Yeah.
I imagine you have to be relatively flexible though in that approach, in that obviously each person that you're going to be meeting with and dealing with in that sense is going to be different. And so obviously everyone learns and kind of takes in information and has this brain candy, right, in very different ways. So I imagine you still have to be reasonably flexible in terms of how you apply like your creativity and your approaches to different people based on who they are. And once you've built up a relationship and a rapport, like knowing what they respond well to and knowing the sort of things that wouldn't get as far with a certain type of person.
It reminded me of, it reminded me of a piece of advice that I got when I first started was start by explaining like the information like you would to your mom and dad, assuming your mom and dad aren't like Nobel Prize winners, but explain it to them, explain the information like you would to your mom and dad, and then gauge the response, whether they want to dive deeper and they understand, like that sort of thing. Start there and then navigate. And that was a really good piece of advice when I first started.
Yeah, Chris, I was going to say too, you do get the extreme, and I'm generalizing a lot of the thought pattern and process on how I try to mentor MSLs on soft skills. You will get the straight, as we call it, blues out there from a personality analysis standpoint. And I think going back to meeting preparation, that's probably 70% of the interaction is doing your own homework. And we talked a little bit last week on Ashfield's, the podcast that we had at the Reuters event. And we were talking with Matt on the health side of things and how we're using analytics as a tool to leverage partnerships and engagements. And I spoke very briefly on the function of medical affairs because I think it's still a new world that we're trying to develop and harness the technology. But I think going back to that Reuters webcast, one of the important things to really highlight is, we're not working in a silo anymore. As before, when we were talking about old school, what an old school MSL is to how it's evolved over time. The new MSL, the new role really entails our medical affairs staff to utilize that technology. How do we work cross-functionally while staying compliant and incorporating all the new tech that's coming in? We hear AI being thrown around a lot. And I think if we can effectively harness that technology for our medical affairs teams, use that, universal, I guess, platform that a lot of people now are using, digital communications. Even our experts, our medical experts, are using that in the field. How do we take the bits and pieces of all that and find out whether or not that person we're engaging is going to be on the very technical data driven side, or are they leaning in the middle? Are they going to the right where they're just not very serious, and a lot of it is just talking about their kids and how things are going, and we're never really hitting the mark. So I think part of the skill set is doing your homework and adjusting your personality and your conversation along a sliding scale and saying, how do I adjust to that person on the other end? And how do I adjust my emotional intelligence? How do I adjust the conversation piece? Am I going to go into this meeting knowing that I'm really not going to get a lot out of it from a data piece, but I'm really going to bond more with them emotionally? And sometimes we talk about key performance indexes and metrics. You can't quantify the emotional impact relationship-wise that you will have with that KOL a lot of times, because what it does mean is you're coming back and they want to engage with you, but it's not necessarily something that you can put a number on. So sometimes you can, in terms of, yes, I went out, I had a meeting with that person. That counts as like a metric. But the intangible value is something that I believe is a skill set that not only MSLs need to have, but it's necessary to, when we do have those conversations and we need those insights being brought out, getting the emotional buy-in is extremely important.
I'm glad I'm nodding my head because I'm like, is he going to mention the M word, metrics? But you're so right. That's it's so hard to measure the quality of interactions. And I think we should do another podcast on that entirely, and how you envision how to do that in a way that is qualitative and quantitative. When you're having a really challenging conversation, an important skill to learn is how to gracefully say, I don't know the answer to that. We can't know everything, right? We want to, we feel like we should, but we just can't. And sometimes you're going to be in a situation where you don't have the answer. You don't have a good answer. You can pivot. That's part of our skill set. You pivot to something else, but gracefully being able to say, I don't know. That's a great question, but I'll do the digging for you. That's part of my job, and get back to you on that, which could lead to follow-up interactions and sort of more touch points and deepen the relationship. But But I think that's something that coming out of a PhD, you tend to be an expert in the field that you study, right? And so you feel like you know all the answers. But when you're an MSL, it's important to understand how to say, look, I don't know that, but I'd be happy to dig around for you. What do you think, Jeff?
No, I think having the vulnerability to admit when you don't have the answer really brings credibility, in my opinion. I think what we try to teach our MSLs, and particularly when they're going through the process of interviewing, one of the most, I think, common mistakes, and one of the reasons that most pharma companies require that MSL candidate interview and present, is just for that reason, is it's not meant to do it on purpose, but I almost want to see if there is a question about a topic they want to present on, or maybe it's a canned presentation and I have a question on it. A lot of newer MSL candidates will make the mistake of, if they don't know the answer, they'll fudge it. And that is the one characteristic flaw that I look for when evaluating talent for a team. I don't want to see them fudge it, because it loses the capability of them gaining trust with that person. And admitting when you don't have the answer is great. I would say within reason, right? Because you are the designated medical expert within the company, right? So you should have some of the answers. So I think it's a balance. I mean, there's a responsibility of you as an MSL to know your technical data, and because you're presenting it to that KOL. So the onus is on you to do that research, right? But at the same time, you want to feel like you're bringing value to that conversation, and based on the homework that you've done, right? And so I think during the conversation, if you get some people that are just inquisitive and say, hey, I have a question about this. And you spoke about the indication, or has the company looked into researching this drug for this disease state, right? So maybe we have the data to speak to that, maybe we don't. I find that when you get in those situations too, what helps is clarifying questions. So when a KOL has a question and you don't have the answer to it, one of the things that I try to encourage my team to do is get clarification. Sometimes you're being that private investigator to the crime scene, and you're pretty much having to ask, well, what happened here? What time was it? Some of the specifics, without being too irritating, because it is a balance, right? But really genuinely being interested in what they have to say. I think that's probably key with a lot of experts, is going in and really just having a genuine, discovery conversation with them. And geeking out with them.
Yeah, the biggest compliment I've ever gotten from one of my thought leaders was, we were out at a dinner, and at the end he said, I just really enjoy your curiosity. I was like, yeah, that's the biggest compliment I could get. Thanks. And because it was genuine, we are curious people. We just tap into that. It makes the conversation run a bit more smoothly. Yeah. So I didn't mean to interrupt you. Sorry.
No, not at all. I was kind of thinking the same thing.
Approach it from a place of curiosity. And the other thing is, there's a new MSL that Jeff and I both know, and she's excellent and at presenting and having conversations around the data. And one of her tricks is to, as she reads through the presentation on her own, is think about all of the questions that she could be asked about it, about each slide, each piece of the publication, that sort of thing. And She's really well prepared in that sense. You know who I'm talking about, Jeff? Yeah.
Yes, I do.
Yeah. So that's another trick. I mean, I think that's one way that helped me one trick that helped me get through all of my studies is as I was preparing to be tested or whatever, I would think, okay, the professor slide. And that's a good way to prepare for your presentations too, or your talks to KOLs. What could they ask about this?
I'm going
that goes
back.
over to sorry, I was just gonna say quickly interject there. I think that goes back to the point that we're saying, which I kind of put like a quick note of like vulnerability leads to credibility, because even having your own vulnerability to I'm gonna spend some time thinking about the weirdness that could happen if I get asked this question, takes that vulnerability, even though you're in your own little safe space as you're practicing and going through that. But I think that kind of goes back to that point, is that you're preparing by being vulnerable, which will then make you more credible because you're prepared.
Yeah, it's scary. It can be a scary feeling. It can be anxiety provoking for some people to do that, to be vulnerable. But that's what courage is. It's living with your full heart and being vulnerable. Sorry, I know I sound a little cheesy.
No, that feeds the curiosity piece as well. Like, I think,
yeah,
by being vulnerable and saying that, I don't have all the answers right now. And I'm not going into this with this perception that I know everything. So you're being vulnerable, but that's also your own curiosity to say, I'm willing to ask questions of myself, of the data that I have, or whatever little environment that I'm in here. I can actually take a step back and say, maybe I don't have all the answers. And then you end up getting more of the answers because you pause there. I know this is why I would not be a great MSL because
I wouldn't say that, Elizabeth.
I am not that inquisitive of a person. Sometimes I'm just like, and then later I'll be like, oh wow, it just takes a minute for me to regurgitate and digest the whole conversation to then come back with some kind of like really compelling line of questioning. But I always have the admiration for people I encounter who just like how that a person that said to you, I admire your curiosity. And I don't think anyone would ever say that to me because I'm just like, I'm just so locked in on listening.
But listening,
or I'm so taking in other things, maybe
Elizabeth, you're
that
so
I'm not
right.
coming right back with those good questions.
No, you're right. Listening is like 90% of the job too. Listening and responding, but mostly listening and responding to what the other person is saying, but really listening. Because you like an MSL comes out of training, they know they are trained on the data, they're excited to present it, and they just want to share. And listening is sometimes forgotten. And the other thing is like, we're trained by the company. And so sometimes the messaging, there's a sprinkle of commercial in there that doesn't necessarily resonate with the people sitting across from us. And, whether they're at an academic institution or, just a practicing clinician, it doesn't. So I think it takes time to understand what the messaging is for yourself, using your curiosity, your vulnerability, as you come out of training, because sometimes there is that commercial, what am I trying to say, twist to our training as MSLs. Right, Jeff, do you agree with that? Sometimes you get that sense when you're training that, this product is the best product in the whole world based on this data, And if you sit there and go through and ask yourself, well, what kind of questions will I be asked that kind of pokes holes through this? And how comfortable am I responding to that? Using various talking points.
Yeah, I think it's important to lay the groundwork out on that first interaction or that first meeting. Because Tiffanie, I know that you find this is probably the case with the current role that you're in now, but just defining your role without being overt about it. And there is a fine skill of that. It gets back to soft skills, Elizabeth, we were talking about before. you almost have to apply that in defining your role to academic and institutional level practitioners, as well as community level. I would say it varies from community to more of an institutional level as far as understanding what MSLs do and their role. But you'll find that the general perception is that, yes, you still work for industry. Yes, it is a for-profit agency that you're working for, right? The bottom dollar still has to be rung in. But when you're communicating the data in the capacity of an MSL, one of the important things to really make sure that it's clear from the get-go is the data is what it is. It reads how it reads. And probably one of the hardest obstacles to overcome, whether you've been exposed to industry or not. And I've had a lot of MSLs that have come from commercial that want to do more of a medical role. So you have to sort of retrain their brain and their thinking, because you're not promoting anything. You're not selling anything. You're selling yourself, and your personality is what you're selling. You're not selling a drug or a compound. But if you think about it, they're buying your personality for future meetings and wanting to hear what you have to say based on the fact that you're conveying transparency, data, and you're not conveying your opinion or your interpretation of the data. Once the data is shared, it's up to that person, the observer, the key opinion leader. We call it KOL. It's a very common term. It's how they perceive it. Now, they might have questions back to our MSL and say, that looks kind of sketchy, this is what I think. Oh, that's really interesting, and getting the notes and doing some of the detective work to kind of bring back to the company. But in terms of what the fine lines are, and where that curtain kind of goes in the middle of commercial and medical, it's just really important to make sure that key opinion leader understands your role within the company, knows that, hey, look, you know what, the data is going to read how it is. It's really up to you how you want to receive and interpret that data. Now, whether that goes to a script later down the road, that's great, because you need that wheel to turn in a big sense, right, from a business standpoint. But ultimately, it's building that relationship, because I might end up calling you back up for maybe an advisory board, or, if you really find that you're using this drug on the patients and it's working for the patients, perhaps there's an opportunity for you to speak, on behalf of our company. But again, that's way down the road. That's building the story at the end of more or less the chapter. And the focus really needs to be on you and them, and finding out, hey, what are the interests here? And what are some of the feedback mechanisms that I can communicate back from that expert to our company?
We are liaisons. Yeah, exactly. Like it's in our title. We are liaisons. We're the go-between between the company and we're the face of the company. We're the medical, face of the company. So it's so important to maintain our credibility and the data, let the data speak for itself and collect insights on where there might be deficiencies, where there might be room to grow based on key opinion leaders' feedback.
I feel like that is probably a good way to kind of round off our conversation. Like that just summarized everything that we've kind of been going through on this session. So I guess, it's amazing because we're only scraping the surface of the complexities around this role. We know that, we've been discussing how like digital and omni-channel communication skills are not new to the MSL role. And then there's all these other traits that kind of support how you leverage those channels. And, being in the pandemic and times of restricted access, the preferences and availability of KOLs are changing. And staying ahead of that means, amplifying the skills that help MSLs become more engaging, breaking through the noise, developing those meaningful relationships. So Jeff, Tiffanie, thank you so much for helping us kick off this exciting new series and for your expected return to our next installment, which we're looking forward to announcing in the coming weeks. So I guess I'll turn it over to both of you for, final thoughts.
Tiffanie?
Do you want me to go first?
First, yes.
I think this was great. I wish that I had access to a conversation like this when I started out as an MSL. And even now, I think it's a helpful reminder. We get caught up in the noise. It's sometimes MSLs work in silos. We're individual workers, and we kind of get caught up in the noise. But having a conversation like this just is grounding in a way and reminds us, what's important. So.
Yeah, I agree, Tiffanie. And this has been great, Elizabeth and Chris. I appreciate you pulling this together for us. I'm excited because as we were going through this first podcast, I was thinking, oh man, there's so many different topics that we could probably spend another hour on. And, from a compliance standpoint, there's experiences that I'd like to share through this Ashfield venue and bring on other guests to our podcast. I mean, Tiffanie was just the first person that came to mind because, I am working with her and trying to, share a little bit about sort of the world that Ashfield is. And we have a company with a remarkable group of talented individuals. And I would say that being able to, for any MSL, whether they're with Ashfield or they're not, I think when I first started out as an MSL, it was just like there was no guidance. And we didn't have podcasts that we could just listen in and tune into to hear these conversations. And I think TED Talks and several other venues out there have popularized this way of communication. But a lot of times it's the convenience of just being able to tune someone in and be part of a conversation and learn a lot, because it's like having the MSL whisperer, if you will, saying, you know what, I learned my lessons. I had bad experiences. This is how I would have done it. And from an educational standpoint, if we can shed any sort of, I would say, insight to an aspiring MSL candidate, I think this gives them an edge on preparing for that first career step. So thank you.
Thank you.
Thank you for listening to our podcast. If you enjoyed it, remember to stay tuned for future episodes. For more information on what we do, please visit our website at www.ashfieldengage.com. Thanks.